This is Today with Kathie Lee Gifford and Hoda Kathie.
All right.
Are you losing your mind?
Yeah.
It could be something other than dementia that's causing your memory loss.
And on a lighter note, we're going to go wild over. It is time for Boomtastic as we look at the topic that affects many of us, memory loss. It's easy to think you're sliding toward dementia when all of a sudden you can't remember a name or you completely forgot to show up for an appointment.
But that's not necessarily the case. There are other factors at play that mimic the signs of this disease, but actually have a cure. AARP covers this topic. Barbara Hannah Grufferman is a contributing editor there. And Dr. Brett Osborn is a neurosurgeon. Excuse us.
Hello, Fancy.
So nice to welcome both of you.
Let's talk, what are the real symptoms of dementia? Because I think a lot of people aren't quite sure.
Or they think dementia is the same as Alzheimer's.
I think that's a really big misconception. I mean, dementia is like a group of symptoms, whereas Alzheimer's is a brain disease, and that's really the difference right there. And Alzheimer's is under the umbrella of dementia, and Alzheimer's is about 70 to 80% of dementia cases. So that's number one.
My father was misdiagnosed with Alzheimer's.
When he had dementia?
When it was Lewy body dementia, which is another terrible disease as well.
What if you're like a lot of people watching are probably forgetting things and they can't remember names or keys? Should they be concerned that there's dementia at play?
That's a good question. That always happens to me and lifelong, really. And so I think it's in the range of normal.
It's a great question. And just like your iPhone or your computer has glitches, we have these glitches on occasion. And those occasional glitches are completely normal and within the realms of normalcy. When they become contiguous and start affecting your activities for daily living, then it becomes a concern.
How do you define that, though? Like more than 10 times a day?
That's concerning.
Okay.
That is concerning. And also, you know, I walk out of my house and I always have this issue with direction. And I know that, again, that's in my normal. But if it started to happen more often, that's when I would really
you got to be
think.
and you got to be honest with yourself, don't
Yes,
you?
you have to be vigilant.
You can't live on that river in Egypt.
When you're on the edge there are certain things that we are in control of that we can do to help kind of stave it off, right?
Absolutely.
What can we do?
It's really all about nourishing the brain. You know, I think so many of us think about what can we do about our heart, but what can we do about our brains? Well, how can we exercise our brain, nourish our brains with?
The answer is that when you fuel the body, you're fueling the brain as well. So the things that augment the cardiovascular system augment the brain as well.
Right. It's all one thing.
That's correct. Everything is the same. There was a very, very large study, actually 2 large studies that just came out recently that suggest that exercise actually maintains the size or it even increases the size of the area in the brain known as the hippocampus, which is the memory hub of the brain.
Right.
And what they did was they compared patients who had a genetic predisposition to Alzheimer's disease, didn't exercise, to those that did. And they found that the 3% decrease in size of this memory hub in the brain that occurs in the patients that have the genetic predisposition to Alzheimer's disease did not occur in those patients that were exercising
so it's more
vigorously.
important than we've even ever thought.
Absolutely.
And also eating other ways to nourish the brain or eating the right foods, including, you know, healthy oils like nuts and olive oil.
Let's quickly,
and also
you guys,
getting rid of stress.
We just have 1 minute, so I just want to make sure that, because we talked about things that mask dementia, let's quickly go through them. B12 deficiency.
Yeah, that's so important.
So if you have a B12 deficiency, that may be your issue, not dementia.
That's
And
correct.
it's so interesting that this is something that is checkable, it's treatable, and it's also preventable.
Is that, did you find that out by a blood test?
It's a blood
just a simple
test.
blood test.
Diabetes, that's another one.
Diabetes and also thyroid. And the thyroid, the TSH test, is something that can also be added onto your blood work
So when you go to the doctor,
annual exam.
ask for it if they don't.
Absolutely. They
for it.
will not normally
Insist upon it.
Insist when you're over 50.
Okay.
For sure.
All right.
All right. Thank you so very much. I
guys.
forgot what we just talked about.
Are they still talking?
No.
All right.
Get set to pirouette, a performance by the School of American Ballet.